Unsafe abortion, it comes in like someone has gone to a place, someone who is not skilled, someone who is not having that techniques how to do this termination, and happen to terminate this pregnancy. So you find that this person is unskilled, and then also it may happen in a condition or in environment that is not clean and safe, and we end up with complications. So we end up having that, we call it as unsafe abortion. Yes, but besides that, we need also to look at the safe abortion, because there are certain things that may happen and they are forced to do the safe abortion. So for the safe abortion, we will call it, it is going to happen in a facility. There is a facility under a skilled personnel. Yes. So after getting to know all those, there are certain things that may happen. For example, when they come to the hospital where I'm working, they have been getting mothers coming with issues. Their pregnancy is not yet 9 months or 40 weeks like the way we count. There are things, for example, maybe the mothers come complaining of low abdominal pain or severe pain. So when you call out a scan, you find that this pregnancy has not really formed well and it has to come out. So we end up getting interventions that we do it in the hospital. When it comes to unwanted pregnancy, for example, it has happened through rape, through defilement, through incest, all that kind of aspects. The law accepts to terminate the pregnancy. However, there are certain things where a mother may be pregnant and is forced to terminate this pregnancy that is unwanted, really. So what happens is that a lot, maybe the financial support, maybe the partner is not supporting her, maybe there could be some school-related issues. For example, these school dropouts. You find that this girl is pregnant and then is forced to come out of that school and then goes somewhere, maybe to the traditional birth attendant, someone maybe in the community that is able to do this unsafe abortion.
However, I want us to focus on what we call post-abortion care, and that is something that has been integrated in the new health guide, self-care health guidelines of Ministry of Health. And under it, that's where they have put all these circumstances, and they have put three outstanding circumstances: uh, risk to life of the mother, fraternal abnormalities, and then instances of rape, defilement, incest. However, I don't know if it was a technical issue or not, but they didn't talk about the advanced HIV issue. They just put it under risk of a mother's life. So they bracketed it, which would have been okay, but we don't like issues of bracketing things in the Ugandan context because they tend to leave a lot of vacuum. Secondly, as you heard from the midwife, these instances are allowed in medical terms because an abortion is a medical terminology of anything that can happen to a pregnancy before it's due time. However, what we are saying is you can have a choice before even that due term, before the start of life. Because when we look at issues of safe abortion, it is more of when does life become due.